Osteoradionecrosis. Osteoradionecrosis is a radiation-induced bone injury. It is a radiation-induced bone injury characterized by hypovascularity, hypocellularity. This hypovascularity, hypocellularity, and hypoxia. 3H. These are the 3H which can be seen in osteoradionecrosis, leading to bone necrosis. Which can cause bone necrosis that fails to heal within 3 months in the absence of a tumor. So the important characteristics of this osteoradionecrosis is the 3H, which is the hypovascularity, hypocellularity, and hypoxia. Next comes the clinical features. So under these clinical features, there will be exposed necrotic bone in the oral cavity which persists for greater than 3 months. Exposed necrotic bone. And there will be pain, which is dull aching or sharp shooting pain. Then there will be secondary infection, foul odor, or pus discharge. You can see foul odor from this bone or any pus discharge, and swelling or erythema. And there will be chances of pathological fracture in advanced cases. Why there will be a pathological fracture? Because the bone will be more thin. There will be more chance of fracture because there occurs hypovascularity and hypocellularity and hypoxia. So the bone fragments tend to thin or it become more fragile, and there will be chance of paresthesia. Paresthesia means there is sensational loss. Why there will be paresthesia? Because the inferior alveolar nerve passes through the mandible. So there will be chance of paresthesia. And there will be trismus. Why there occurs trismus is if the masticatory muscles are involved. So the clinical features are exposed necrotic bone, pain, secondary infection, swellings, pathological fractures, paresthesia, and trismus. Next comes the management. For the management, we can classify it into 3. So for conservative management is for early or smaller lesions. Under this conservative management, we have oral hygiene maintenance, antimicrobial mouth rinses, which is chlorhexidine mouth rinses, 12%. So there is oral hygiene maintenance, antimicrobial mouthwash, then systemic antibiotic and analgesics, then sequestrectomy or saucerization. Then there will be hyperbaric oxygen therapy. So what is sequestrum? It is the bone fragments which forms within the bone. So sequestrectomy is the removal of these loose necrotic bone. And hyperbaric oxygen therapy, we give oxygen as a treatment procedures to treat the hypoxia. And next is the surgical procedure for advanced or extensive lesions. So resection of necrotic bone with adequate margins, reconstruction with vascularized bone fragments, then soft tissue coverage. These are the surgical procedures. Then comes the preventive management. It is given before the radiation, dental evaluation, extraction of hopeless teeth, treatment of infection, and patient education. Next comes radiological features. There will be ill-defined radiolucent area. There will be ill-defined radiolucent area, and there will be moth-eaten appearance. Moth-eaten appearance is the characteristic features of this osteoradionecrosis, and there will be sequestra formation. Sequestra is irregular radiopaque bone fragments. Then there will be periosteal reactions and pathological fractures. As I told you earlier, there will be chances of pathological fracture because the bone is very fragile. Then there will be loss of lamina dura, widened periodontal ligament space. So these are the radiological features of this osteoradionecrosis. We can see this is the sequestrum. This is the loose necrotic bone formation within the bone. Okay. And next comes to the complications. Complications of the osteoradionecrosis is chronic pain and infection, pathological fracture, then there will be fistula formation and nerve damage. As I told you earlier, there will be chance of paresthesia because it involves inferior alveolar nerve, and there will be chance of trismus and decreased quality of life because of this fragility of the bone, and there will be difficulty in mastication, speech and swallow.